Having occasional feelings of anxiety is a normal part of life, but people with anxiety disorder experience frequent and excessive anxiety in everyday situations. It could be caused by specific situations as they unfold. It could also be a response to your thoughts about things that have already happened or that on the horizon. Anxiety is a very common problem. WHO puts the number of people suffering from problematic anxiety in 2017 at more than 300 million. 6 most common types of anxiety disorders are OCD, short for Obsessive Compulsive Disorder, Panic Disorder, PTSD, short for Post-Traumatic Stress Disorder, Social Anxiety Disorder, which is not just extreme shyness but a deep fear of being judged by others. Specific phobias are another type of anxiety disorder. You have a phobia when you are excessively anxious about specific object, place, or situation and you go out of your way to avoid it. Another one is generalized anxiety disorder, which is experiencing anxiety frequently for 6 months or more. Here is some suggestion to cope with an excessive anxiety. Exercise most days of the week. Exercise is a powerful stress reducer. Use stress management and relaxation techniques. Visualization techniques, meditation, and yoga are examples of relaxation techniques that can ease anxiety. Make sleep a priority. Identify triggers. Learn what situations or actions cause you stress or increase your anxiety. Practice the strategies that you are ready to deal with anxious feeling in these situations. Socializing is very helpful. Focus on things that you can control. Avoid excessive caffeine and stimulants. Medications could be used to treat anxiety disorder. Benzodiazepines such as Xanax, Librium, Klonopin, Valium, Ativan are used for short-term treatment of anxiety. That is because they cause drowsiness and problems with balance and memory, and they are habit-forming. My favorite medication for anxiety is Busperon. Brand name is Buspar. It is used to treat both short-term and chronic anxiety disorder. It is not fully understood how Busperon works, but it affects chemicals in the brain that regulate mood. Busperon takes up to several weeks to become fully effective. Benzodiazepines could be used for short term until Busperon kicks in. Antidepressants can be used to treat anxiety symptoms, but they also take 4 to 6 weeks to produce any noticeable effects. Types of antidepressants include SSRIs, short for selective serotonin reuptake inhibitors. They work by increasing the level of serotonin, a neurotransmitter that affects mood, sexual desire, appetite, sleep, and memory. SSRIs are usually started at a low dose that your doctor gradually increases. Examples of SSRIs include escitalopram, brand is Lexapro, fluoxetine, brand is Prozac, paroxetine, brand is Paxil, sertraline, brand is Zoloft. Another class of antidepressant is SNRIs. SNRIs like venlafaxine work to influence both serotonin and norepinephrine by preventing brain cells from rapidly absorbing these neurotransmitters. SNRIs like duloxetine are also used for chronic pain. Tricyclic antidepressants are second-line drugs next to SSRI and SNRIs as they are old and cause more side effects. Clomipramine is a tricyclic that is used for OCD if SSRI like fluoxamine fails. Beta blockers are most often used to treat heart condition, but propranolol from this class is used off-label to help relieve physical symptoms of anxiety, especially in social anxiety disorder and public speaking anxiety. Hydroxyzine is an antihistamine with anticholinergic and sedative properties. It is approved for treatment of anxiety. Supplements such as chamomile, magnesium, L-theanine, saffron, and valerian root might help to ease anxiety symptoms. So, if you are dealing with anxiety, you are not helpless. There are lots of ways to treat your anxiety.